I will share the surveillance report. We'll go around the horn with the group, and then open it up for questions. If that's okay with everybody. Okay, so here you see our weekly surveillance report. We continue the trend that we've been seeing with a decrease in the number of cases. We're down to about 6 cases per 100,000 per day. That is the direction we want to head in. That's good news. And our positivity rate for the first time in quite some time is just under 5%. That is also where we want it. So having the lower number of cases and having an overall positivity rate down below 5%, we want to sustain both those trends. But that's good news overall. Our testing system, we're seeing a little bit of uptick in the data in terms of how many days it's taking to get to us, but we're not feeling that. We're going to be looking at this a little bit more closely. We're not feeling like the testing is taking that, significantly longer, so we're going to be looking at this data a little bit. Again, you can see the number of cases that were in the onset date. You can see that curve, and you can see the by age decade. The number of cases the cumulative number of cases we have of people in their 20s is still significantly higher. It has leveled off since what we saw in March and April. And we're as would be expected, we're not seeing a lot of cases from MSU. 2 cases in the last week, and 2 active cases over there. Overall, in terms of vaccine status, we are, as of May 17th, that's a little bit of time ago. We had about just under 45% of the county of those eligible for vaccine. So people 12 and older, a little under 45% had been vaccinated. And I think that is really helping us reduce transmission of the disease. I will say, that's a good number. It's not good enough. That means that the majority of the county, remember, we're not even talking about people younger than 12, are not fully vaccinated at this point in time. It is really important that people keep getting those shots and that we keep this trend going. We're seeing a slowdown in the demand, to the extent that we're really changing the way that we're offering vaccines. We had our last first dose clinic at the fairgrounds this week. Not because we're not giving vaccines, but because we just couldn't sustain the demand, the resources that are necessary. The demand wasn't there. If we still had hundreds of people yearning to sign up and come through those pods, we'd still be running them. But we've made the determination that we need to be out in the community, getting the vaccine to people in different ways. And so we're working with some of our contractors to do that. We are seeing in the older age groups, particularly people in their, in terms of fully vaccinated, we have about 84% of people who are 80 and older have been fully vaccinated. About 65% of people in their 70s. This is as of the 10th of this month, so it's a little bit old, but it'll give you a sense. But then you look at people in their 20s who have been eligible for a little bit less time, and we're at just under 30% as of May 10th. So we need those younger folks in particular to keep getting vaccinated to reduce the number of cases. I would say, well, this is good news. It's important that people understand, as of this morning, I think we had 7 people in the hospital, and 3 of them were in critical care. So it continues to be a serious virus. It can cause serious illness. We announced another death earlier this week that happened at the end of April, and we're losing nationally. The number is down. The number of deaths are down, but we're still losing between 500 and 600 people a day. When you put that together for a week, we're losing a lot of people every week to this disease. And so we really need people to keep getting those shots, and the extent to which we're going to be able to return to normal as individuals and as a community is really going to depend on the extent to which people are going to keep getting those vaccines, and that we can keep getting shots into arms. So if people want a normal summer, I think those vaccines are the clearest path to that, and that's where we're putting our resources. With that, I will throw it to, I see Tracy staring at me, so I'll say, Tracy, do you have anything to share?
Matt, I wasn't staring at you. I just so.
Well, you're the only one that had the camera on still. So.
Oh well, I just was so focused on your report. That's all. I don't have any updates. So I'm here for questions though.
Okay, thanks, Kallie. We may have lost Kallie. If she comes back, we'll throw it to her.
Yeah, her screen looks frozen.
Okay. So why don't we start in with questions and see if we have any questions, and then if we get Kallie back, we'll give her some time. Are there questions out there?
Hey, Matt, Nora with the Chronicle here.
Hey, Nora.
Hey, I was wondering, you mentioned kind of changing strategies about vaccines. So I'm wondering what kind of, instead of like, the clinics at the fairgrounds, what's sort of the next step, I guess, for the health department in that realm?
Well, we're really working with, we've engaged through the course of this. Part of the way that we've been running the clinics at the fairgrounds is through, we've had some good partners and contractors, and they're really turning their face and their attention to moving out into the community. And they have some mobile clinics that are being used. We're working with them. I think Wrestler, the auto dealership Wrestler, had an event earlier this week. Our nurses and our staff have been working in the schools, both the middle schools and the high schools, to have shots out there. And so we'll be doing more of that, looking to bring the shot and make it so convenient for people that it's just hard to not do it. That's going to be our effort moving forward. Now, if we get into a situation where we have, for some reason or other, we have big demand, that's nothing saying that we wouldn't have those large mass clinics again, but you really have to have the people coming to you to make those successful. So we're going to take the vaccine to them.
Okay, gotcha. And I was also wondering about variants in the county. I haven't seen the state's report yet today, but I was wondering if you had any updates or any thoughts, I guess, on that situation.
I don't, and I haven't seen the report this week. I haven't looked for it yet. So I don't really have much for you on that. Sorry.
Okay, thank you.
Hi, Kallie. Welcome back. I'll throw it to you if you have anything to say.
All right, thank you. I don't have any updates, but I'm definitely available for questions.
Great, thank you. Other questions out there?
Hey, Matt, Noah Schmick, ABC Fox, Montana. I was just wondering, what other incentivized, clinics, have you guys been working with, either some mobile vaccine clinics or something? I know there's been like Get a Brew, not COVID, or like some other things that have been happening. Have you guys been working with those people to just have some fun things to get the younger population involved?
Yeah, I mean, we have tried to facilitate that and help publicize those kinds of efforts. We're not putting a lot of funding into it at this point in time. I know that MSU is doing some work related to that, and I'll throw it to Tracy, and we're looking for opportunities to do that. I don't know that we have, we don't have $1 million to give away like Ohio, or $400,000 like Maryland is doing. But we're open to that. I think we'll continue to work with partners who want to do that. But we really also think that just making it available and being out in the community and making those things available in workplaces and places where people just may not want to come into the fairgrounds, that's going to be one of the things that we're really focusing on. Tracy, you want to talk about the incentives that MSU is doing?
Yeah, so Noah, through the Montana Department of Public Health and Human Services, the university system as a whole was provided with access to some town pump gift cards. And so here on our campus, we started messaging through social media and email and other means that if you got a shot, you could get a $10 gift card. If you got 2 shots, you could get $20. And of course, if you get the Johnson & Johnson, you still get the $20. So it's $20 total. And we just started that. And we've had 100 people take us up on that, 100 students, which isn't bad considering the student population for our summer session is much, much smaller. But we'll continue to offer that through the end of June. And then we're just doing messaging to students that have gone home for the summer, and home can be within Montana or anywhere in the United States. We'll be messaging to them all summer long to urge them to take the opportunity this summer to get vaccinated if they're not already vaccinated. We can't offer them a gift card if they're living in another state, but we can give them a reminder. So that's what we got.
You know, I think we're open to the monetary and those sorts of incentives. I think we also should emphasize the biggest incentive for everybody is health. I mean, these vaccines are incredibly effective. They're safe and they're free. And so we really encourage people. They're empowering too. Like, not only when you get them and when you get fully vaccinated, there is a feeling of really an ability to kind of move past some of this. And not to say you don't have to worry about it, not to say that it's over, but these vaccines are really a hugely powerful tool, and we really need people to really perceive the benefit of you know, the biggest incentive I can probably give you is your health. And so I would put that out there too. And I know we've been saying that for a long time, but I don't want to just get, I don't mind the incentives. I just want people to understand how incredibly effective and lucky we are to have those vaccines.
Perfect. Thank you, guys.
Other questions?
I had another one.
Okay.
I was wondering at this point in the vaccine process, are there like any gaps in the community that you guys are noticing, groups of people or areas where you know, the rates are lower?
The young people, part of that is probably timing. The people who are in their 70s and 80s have had much longer. There's fewer of them, but they're also at a higher risk, and they perceive themselves at a higher risk. And so those younger age populations is one. And we did notice in our data this last time around, when we looked at ethnicity and race, the percentage of people that we're seeing who are identified by ethnicity, who are identifying as Hispanic or Latinx versus not, is pretty comparable. It's about 33% overall for all age groups, including younger people. When we look at that by race, we're seeing a little bit of a gap opening up for people who are identify themselves as American Indian or Alaska Native. And so, we're looking at that. We don't, geographically, we're not connected to a reservation, but we do have a significant number of people of American Indian or Alaska Native heritage. So we're always looking at that. We want to make sure that we're making those vaccines available for that group of people. And we'll be looking at those on a kind of an ongoing basis. When we look at the difference between people who identify who are white versus people who are African American, that's pretty comparable. So those are the two areas that we're seeing in our data. There might be a little bit of a gap opening up. We should be paying attention to. Other questions? Thank you. Yeah. Other questions? All right, I figured it might be a shorter one today. I appreciate all your time. Again, bottom line is the overall surveillance numbers are getting better, but this remains a serious disease. We continue to see people in the hospital. We continue to see hundreds of people diagnosed with this disease dying every day in the United States. And we have a solution. Get the vaccine. If we can get people to get these shots, it can really protect them. This continues to be a serious situation. But that vaccine is really a pathway to back to a normal summer. With that, I will leave you all and hope you have a great weekend.
You as well. Thanks.